Good afternoon. It has just turned 12 o'clock. Therefore, it is time for Team Brief. I'm Dosan, I'm the Acting Chief Executive, and I'm delighted to be joined today by Elaine Higgins, who's a diabetes specialist nurse, Kaylee Radford, who's a medicine safety and governance technician team lead, which is a bit of a mouthful, and then also Georgina Goulding, who's an Admiral nurse, and Liv is lovely. Liv is on the decks, and we'll be putting some slides up, and we'll show you what we're going to talk about. Talk about Insulin Safety Week, and then we're going to talk about Dementia Week today. As always, just if I can encourage you to put some questions into the Q&A session, that helps. We can then ask our experts that. We'll put some links into that for any information that we mention, and obviously we've got a few slides to show. So that's the usual format. I've got a few topics just to update on. There's an awful lot of weeks currently going around and special days. So yesterday was the International Day of the Nurse, and I don't know if any of you went down to the KTC or any of the other stalls that were around our three sites celebrating that. There was a real buzz, certainly down in the KTC, and it was an ability to just say thank you to all of our nursing colleagues. And then we've got Mental Health Awareness Week, which is about to start, or we're into, which is this Monday through to Sunday. And that's just recognizing the impact that these roles that we undertake have, and also all of our lives in the current confused world that we're operating in. And we're going to put a load of resources into the chat for you. So we've got people who feel as though they need to talk to, who on earth can they talk to? We've got mental health crises access line where anyone can call, and that could be a colleague, a friend, a family member, and the line number will be put in the chat. As I say, that's run in conjunction with Turning Point. And then we've got obviously our VivUp offer, and lots of people have said how good VivUp is when they've talked to me about this, but we'll put the links to the VivUp there. 3 telephone helplines available 24/7 and every single day of the year, and again that's a number we'll put in the chat. And then we do have the ability to access counselling for our colleagues, free for colleagues, via VivUp, to see if that's helpful and require. And then there's NHS England Talking Therapies, again, which is another free service that if you work in the NHS you can access, and again we'll put that in the chat, and that's something you can directly refer yourself to without having to go through your GP. And we'll put that in there. And then finally, a couple of other ones. There's an Unmind app, which is a mental health platform that empowers staff to proactively improve their mental well-being, and we've got that ability here, and again that's free for staff. And then the last one is around the mental health awareness training for colleagues, and there's a React mental health awareness training tool, and we'll put that into the link. So a whole host of things to celebrate Mental Health Awareness Week, and also a whole host of resources that we'll put into the chat and are available on our website. And then the next one to just mention is our Excellence Awards. So obviously we've got Excellence Awards coming up in the autumn. It's a great opportunity just to say thank you to people. The buzz in the room, the emotion that entails just recognizing people, how far they've gone above and beyond, and what a fantastic job they do. It is a phenomenal event, and I'd encourage you all to nominate colleagues. We've extended the nominations deadline. I think we've got about 221 nominations so far, but we've extended the deadline until Sunday the 25th of May. That's just to really get as many people nominated as we possibly can. We do have resources to help write nominations if you want to, and people in our comms team can help you with that. But you know, the shortlisting is done on the nomination, so the more that you put in the nomination and the difference that people make, the greater it is for those who are judging, which is always a fiendishly difficult task, but it gives us the ability to perhaps make that decision on who should be shortlisted. So there's an online form which you'll all be very familiar with, and again, I'm hoping that Liv will be putting that in the chat for you. And we can do paper nominations for those of us who are digitally naive, is the phrase, and we can do that. So, and all of the information about the Excellence Awards is there. The people who get nominated, they get invited to the event. This year, we've changed the venue. Previous years, we've held it in the John Fretwell Sports Centre. This year, it's going to be in the Mansfield Town Football Club. So we're going to hold it there. It allows us to invite just a few more people, and just allows the hopefully less people to have to drive. So it should be a fantastic evening, and I look forward to reading all of those nominations. So I just encourage you to nominate colleagues who've gone above and beyond. Nursing midwifery and AHP strategy is the last update that I've got. We're delighted to share that the new nursing midwifery and AHP strategy is now live, and again we'll put a link into that. Colleagues from across our various disciplines came together on Tuesday, today, to celebrate the launch of that, and it's to help support us to deliver our overarching trust strategy, improving lives. And it was developed in consultation with representatives, obviously, from our nursing fraternity, midwifery, and the allied health professionals across the whole organisation. And over 880 people helped contribute to creation of that plan over the past year, and it will deliver key areas and how we will serve our community, support our workforce, and sustain and grow. And we'll put that link in for you. So all of that information will start to come your way. I've got a couple of other things that are not on my script, so I'm going a bit off piste. So the first one is just recognizing car parking. So we know it's a problem. I know it's a problem. It's certainly been compounded since we reclosed the car park 15 where the MRI construction is happening. The loss of those 70 or 80 spaces seems to be the tipping balance that goes from it being difficult to be extraordinarily difficult, and we recognise all of that. We recognise that Tuesdays and Wednesdays are the busiest days in the trust, and often colleagues struggle to park. What I was just really going to say about this is that we have got a car parking group who are made up of a variety of different colleagues and team members, staff members from all the different levels working together to try and address some of these. We have been actively trying to source additional car parking. I didn't want people to think actually we were not doing anything about it. It has been quite fiendishly difficult to source additional car parking, but obviously there are some local big stores around that we've been talking to that's been difficult to negotiate. We think we're close to securing some additional car parking spaces at one of those big stores, and obviously we will then ask that car parking group to decide how we allocate those. At the same time, we've also secured some additional car parking at a pub not too far a walk away. Currently that pub's having a bit of building work done, so the car park's full of building work, but once that gets moved, then we'll release that, and that will hopefully add to all of this. And then the final definitive solution is right down at the front where there's enormous mounds of earth, and you wonder what on earth they're doing in the car park. Been there ever since I've been there. So we finally got planning permission to actually remove those and start to create some more car parking spaces down there, which hopefully should be a more definitive solution to all of this. So I think we recognise it's a real problem. We ask people to try and park considerately, and we understand the frustration that this causes across the organisation, but we have hopefully some plans that will start to come in to mitigate most of this. So that's car parking. I'll see if I get away scarred or slightly scarred about that. And then finally, the other thing that I just thought I'd challenge you about on a sort of sunny May day is we've been running the staff brief in this sort of format for really quite a period of time now. I wonder if it's getting a bit tired and we need to change that format, but I just wondered your thoughts on what works for you, how we could make it better, all of those sort of aspects, and any ideas. We can leave it as it is if it's if it does work for you, but I'm not sure it does. And so, you know, is there a different way that we could do it or should do it for you? So again, you can either put some comments in the chat about that, or Liv, whose baby this is really, the team brief is going to put her email address, and you can email her and give us some ideas. Okay, so those are all of my updates, and hopefully that will generate a few questions, not about car parking, please. So I'm going to just move us on to introduce Elaine and Kaylee. You better introduce yourselves and say what you do, and then we're going to go into the discussion about Insulin Safety Week.
Yeah, I'll go first. So I'm Elaine. I'm one of the diabetes nurses. I have been in the trust for a very long time now, so quite a lot of people unfortunately have the pleasure of knowing me or have bumped into me. And I've worked closely with the medicine safety people. So Kaylee.
Yep, so my name's Kaylee. I'm a medicine safety and governance technician, and as Elaine says, work alongside her, and we've pulled some slides together today to focus on Insulin Safety Week.
Perfect. I'm just going to hand over to both of you to update us.
Thank you.
Right, now comes the trick of, that's it. Right. Okay. All the technology's working.
Here we go. I'm catching up. I think it's trying to load.
Can't see anything just yet.
No, it says I'll need to go back to the window where I was sharing to resume. But I don't know which sharing I was resuming from. Let's have another go. Always good. I like this bit. I don't want to stop sharing. I want to share.
The alternative is to send it to Liv, Elena, and she can share the slides if that's easier for you.
Yes, I will. So I'll start. So the first slide is really one. So I'll send the slides through to Liv. Is basically the fact that Insulin Safety Week is designed to make people aware of insulin and just get them up and running with how insulin has a big impact on patients within the trust, and obviously the number of errors that actually happen that shouldn't really happen if we can help it, because if there's a point where we can get people doing safe checks and checking things. So I will apologize to everybody, and I will send the slides to Olivia when I can do that from my multiple computers that I am sitting in front of.
So I think Elaine's touched on you know, reducing insulin errors, and there's a few things that we can do to do that. So basically there's 6 steps to getting it right. So right. We think
going to Olivia.
Yeah, so we want to check that it's the right person, it's the right insulin, they've got the right dose with the right device, it's given at the right time, the right way. So insulin should always be administered using an insulin syringe or a pen device, and we should not be using syringes to withdraw from cartridges, so that increases the risk of errors. We should be giving insulin before a meal. So if we don't do that, its effectiveness is reduced. And we shouldn't, when prescribing, be abbreviating units. So it's a bit more difficult to do with the EPMA now. It doesn't allow that, but if you're in a paper-based area, then that can happen, and that does contribute to errors. So a 10 can look like 100 if we put a little U at the end. And just to share that Trust has a guideline for managing diabetes during the last days of life, and that's really helpful. So I'll just talk a bit about what you can do to improve insulin safety. So use the correct device. So encourage patients to bring their devices from home, or you can access devices. So if it's quick pens, they can be ordered through pharmacy. If it's a pen that you need to put a cartridge into and the patient's not bought it in, they are available on Wards 34 and on EAU. If we can encourage patients to self-administer where that is appropriate, so the paperwork's all in the diabetes care plan, I think we do use it really well, and that helps because we can make sure that patients then are giving themselves their insulin before they're eating. I recognise that can be difficult when you're a nurse and you're busy on a ward to give medicines at a time that's outside your usual medicine round. So if we can get really patients to take ownership of that, then that's great. Just make sure that we are communicating any changes to the patients if we've changed the dose, if we're changing their insulin. If you do get a handwritten insulin prescription, the abbreviations are used, then make sure that's challenged before you administer that. That just helps to prevent any errors from occurring. And familiarise yourself with the last days of life diabetes guidance. It's really helpful. You can see how we should be managing that in our patients' last days. It even talks about, you know, when we should be monitoring the blood glucose levels. I'm just going to hand over to Elaine, who's got some learning available for us.
So as part of sort of the wider health authority or insulin ICB, we do have access to the Cambridge Diabetes Education Programme, which is basically a programme that has lots of different modules at different levels of care that you can access. They say they'll last about an hour, but depending on how quick you are at reading, you can work your way through them quite quickly. There is a free code to access them, and I will make sure that those posters are up around on ward areas. I have emailed them through to the matrons, so hopefully they should be available. But also I will make sure that the links go into the bulletin, hopefully this week, so that people are able to access it and at their leisure if they want to learn a little bit more about insulin safety, diabetes. And on the next slide, Olivia, there is a snapshot of some of the different modules that they do. So we have insulin safety, technology, continual glucose monitoring, which is obviously all the things that people are coming up against now. If we go to the next slide, Olivia. So the other thing I'm very conscious of, and part of Insulin Safety Week, is getting people aware and conscious that we're now getting a lot more of wearable diabetes technology. It is something that's going to increase over the coming years as we've had more access given to us by NICE to be able to allow nearly every single patient with type 1 diabetes access to an insulin pump as well as continual glucose monitoring. And there will be more information coming out as well as a more detailed policy to give you more information about those technologies coming forwards and how they should be used appropriately within hospital. At this moment in time, though, the only thing we do ask is that you are conscious or aware of if a patient is wearing insulin technology, especially if they are coming in a state where they are unconscious or confused. It will affect, obviously, your overall care and how you manage those patients. But if in doubt, by all means, contact the team. Before we move, so these are our contacts. So we are here now 7 days a week, including bank holidays. We have the diabetes patient at risk assessment within Nerve Centre, which allows you to assess the patient daily over the last 24 hours. And this should activate a prompt to see whether or not you refer that patient via ICE. For more urgent calls, we do have a mobile which takes us through from switchboard, but in all honesty, if you do a nice referral, we will get to it fairly quickly and help you manage a patient. With the electronic prescribing, we can sort some of the problems out without seeing the patients, but also sort out some of the prescription side of things for you urgently and make sure that those errors are saved from it. Going back to obviously what Keely was saying about our 6 steps, it is vital that we follow those. Insulin is a critical medication. If it is prescribed, the pharmacy will do a wonderful job of getting those insulins up to you within a 2-hour period and make sure that we're not delaying those doses. And where possible, the patients are the experts. Allow them to manage their own diabetes because they are the ones who will do it the way they usually manage it at home, and that's the best way for them to manage. So really, that's all. Insulin safety is every day really, but this week it's more just to focus on and give you some extra information and allow you to see different aspects. Is it?
Perfect. Okay, we'll take those slides down. Thank you, Elaine. Thank you, Kaylee. So a few things you covered I've written down here. So insulin instances are probably one of the commonest drug incidents that we see, and insulin administration and diabetes can be the simplest disease process, and it can be the most complicated. I think your last point, Elaine, and one of the things I've written down here is basically listen to the patients. They've lived with their diabetes by and large. They know what they're used to having and how they're feeling, and they do get a bit irritated when we stuff them up by changing everything quickly. So do it in conjunction with patients, really listen to them. Obviously the bit about units and writing units and writing 10 versus 100 versus 1,000, all of those things is crazy, and we see incidents with all of those. So that is just something to double check and triple check, really. In terms of the contacting the team, it's 7 day a week. Is it 24/7? You can contact you out of hours.
So we're usually here sort of from definitely around 8 to 4, 9 to 5. It varies on which person's covering, but we are here for a full working day, Monday to all 7 days a week. And obviously, if you do referrals, we are available.
And there are lots of policies around for treatment of diabetic emergencies, which is it's easy for me to say bog standard medical treatment, but we seem to have overcomplicated it a bit. But bog standard medical treatment, and then a whole host of other things which you've alluded to. But it's utilising all of those and then contacting the team in the morning, because a lot of them will come in overnight, I would imagine.
Yes.
Okay, perfect. I'm still waiting for any questions. We put links into the chat. I don't see any other questions that we've got, but it's just a really timely reminder about the importance of insulin. So thank you so much.
That's okay.
We'll see if anyone comes back with some questions. In the meantime, I'll introduce Georgina, who's going to give us a bit of an update around Dementia Action Week. And the first question I said to her that we need to ask is, what on earth is an Admiral nurse? I know the answer to this, Georgina. You know I do.
I hope so. Hi everyone. So my name's Georgina and I'm the Admiral nurse working for Sherwood Forest Hospitals. And like I said, for those that don't know what an Admiral nurse is, I'm basically a dementia nurse specialist but associated with Dementia UK. So a lot of my training, a lot of my links and collaborative work come from that charity. That is the main difference between myself and my colleague Adele, dementia nurse specialist. But we do cover all 3 sites of Sherwood Forest Hospitals. And I am really pleased to talk about Dementia Action Week here today, which is coming up next week from the 19th to the 23rd of May. As we know, Dementia Action Week, it's a raise an awareness campaign which takes place every year across the UK to kind of act on dementia and talk about key themes. This year's key theme specifically is regarding the diagnosis and early diagnosis of dementia, and kind of talking about it, having education about the common signs and symptoms that we see with the dementia, which aren't often the ones that we associate with all the time. So it's important that we're having these conversations all the time with people. Diagnosis is vital to give people access to the right care, the treatment and support they do need. But in a recent study from Alzheimer's Society, it found that 1 in 3 people with dementia don't actually have a confirmed diagnosis. And over half of people who are seeking dementia diagnosis support hold off for about a year or two. We know that there are lots of reasons for this. Many can be avoiding dementia diagnosis due to fear, the stigma, denial, lack of awareness of the condition. And also some worry about losing independence, giving up driving, that life stops, and or the fact that they might need 24-hour care ultimately in the end. Dementia is the most feared condition in the UK. And personally, I speak for a lot of people as well, that we don't talk about it enough to help tackle these stigmas and raise awareness of it as a condition. So on Monday, the 19th of May, between 10 and 12, myself and my team will be emphasising the importance of dementia diagnosis in the KTC with a dedicated stand to kind of talk about diagnosis, talk about memory assessment service, and really having open conversations about what to expect through the memory assessment process, kind of what symptoms do you look out for, providing with signposting and support, and most importantly, having just normal conversations and opening up those barriers about dementia. Like I said, we'll have posters, we'll have contact details to share, as well as the Alzheimer's Society symptom checklist. That's been a really useful tool for us as a team, as well as sharing out with patients and visitors and staff. And it helps initiate and support difficult conversations about memory, because it kind of goes through each kind of symptom in detail, and you can kind of say, okay, I have been experiencing that for a few weeks now or a few months, or okay, I didn't realise that was a sign of dementia, maybe I should go and look into that a bit further. And it's really opening those barriers. On Tuesday the 20th, we want to focus on life after a diagnosis, because whilst it's important to recognise that diagnosis is important, we want to make sure that we're breaking the stigma about that life doesn't stop once you have a dementia diagnosis. Our Adventure with Dementia stand will focus on the importance of maintaining independence and continuing to do the things that you enjoy despite the cognitive decline. And on Friday, we'll emphasise the importance of advanced care planning. So we're kind of looking at it from both aspects of the disease. So that real diagnosis, and then obviously ultimately the end and planning for that time. We know that having these difficult conversations are crucial, and to have them as early as possible about the care and wishes for your future. Again, this is something we definitely don't talk about enough, especially when someone has a dementia diagnosis, but it's so important to plan ahead when someone has the mental capacity to do so. I know in my role, we often have that period where we miss the boat with people, and having these conversations early on, post-diagnosis, is really important. We'll be discussing things like lasting power of attorney and the best resources to document your wishes with loved ones and medical professionals. Wednesday the 20th will be at Newark, and Thursday the 21st we will be at MCH to ensure that we are covering all 3 sites, and we'll have a condensed kind of version of all 3 displays to showcase over there. So please make sure you do head down and see us. Like I said, we're always willing to answer any questions and have these conversations, because if I leave those days with just having one really good conversation with someone, then I know that we had a good week. But yeah, come and see us, see our resources, see our contacts, and have a chat about dementia. I know whilst I'm on this page as well, I've asked Liv to share our patient story recently, that Brian's brain. I want to cascade this to actually absolutely everyone, and as many people as we can. And it is a story about Brian, who was a patient living with dementia who was nursed here at Kingsmill. Just a heads up to you all, it is an emotional one, but it does show how we don't always get things right, but more importantly, we know how to overcome these barriers, to learn from these events, and how we can ultimately improve patient care. So like I said, I'll get Liv to share the link to the story. It is up on YouTube, and if you do have any questions, and please don't hesitate to get in touch with the team. We can meet, we can discuss about any questions that you may have. And I think, Dave, that's it from me.
Brilliant, thank you, Georgina. And
thank you.
So that video is a really powerful video. I would just encourage everyone to just steel themselves and watch that. One of the things that we try and do with both videos is it's great for us to say, oh, aren't we fantastic, but actually sometimes we don't get it right. And it's important. That's where the true learning comes from. And so we showed this at the board, the trust board, and in fact, unbeknown to us, the family attended, didn't they, Georgina?
Yeah,
And we weren't aware that they were going to come and attend, and that made it even more powerful. I think having one of the daughters, Brian's daughters, in the room, that just adds to the ability for us to learn from it and to make some commitment. So I'd encourage you all to watch all of that. And it's important for us as an organisation to recognise when we don't get it right. And just there's a couple of things then that I don't think I've got any questions in there, so you're going to have to put up with my questions. Two things. There's something about the dementia diagnosis, because the dementia diagnosis is quite an emotive diagnosis, and we don't want a dozy doctor like me going along and saying, "Oh, you're a bit forgetful, you've got dementia." If they haven't got dementia, if that makes sense. So who makes the diagnosis, or what do you advise around that?
Yeah, so I think the earliest opportunity you can, where you think, okay, I'm showing symptoms of diagnosis, speak to your GP, because that can start that memory assessment service process. They can get the referral into the memory assessment service. I can't lie, it is a long process, which is why we need to kind of really push people getting through to the GP as soon as possible, because what we need to do is confirm that what your symptoms are showing at the minute, is it a acute reason why? Is there a delirium? Is there infection going on? Memory assessment service then like about a 6 month to a year period that you're displaying these symptoms. So yeah, you can imagine that, if tomorrow I started getting confused, it's not as simple as going to the GP and getting that support there and then. It is a lengthy process, and again, people don't understand that. We had an email this morning about a relative that said, my mum's been confused for the last 10 weeks. Can we get diagnosed with dementia? And it's not as simple as that. And it's just making sure we're signposting people properly.
And there are lots of different types, aren't there, of dementia? So, the one that's currently lots of advertising campaigns around is around Alzheimer's, but there's vascular dementia, there's alcohol-related dementia, all sorts of causes, and they have slightly different treatment paths, if we can say that, or supportive paths.
Yeah.
Okay, and the other question I've got, just looking for anyone else to ask any questions, is so there's something. So one of the things that is really helpful is some of the tools that we use for memory aids, if you like. So obviously, dementia clocks, using pictures, all of those sort of things. But also there's some simple things, aren't there, like different eating implements and those sort of aspects to how. So how do if we've got someone who's just out on a general ward, how do they get hold of you, and how do they get access to all of that?
Yeah, so in terms of getting hold of the team, we work full working days, Monday to Friday. So generally between 8 till 4, 9 till 5. You can give us a call on, I can pop our contact details if that's easier, in the chat box. But give us a call, or if it is to refer a patient, you can also send us an email to the shared, so everyone in the team will have access to that then. Like I said, I know we've done a standard operating procedure about the referral process, and I in particular have a referral criteria from Dementia UK, but in my opinion, I would rather get 10 referrals a day just for some simple questions than nothing at all, because you may think it's not appropriate to refer to us, because sometimes the smallest ideas make that biggest impact on the patient. So if you're thinking of a small way that you can help that care, then we are more than happy to support you with that, whether it's big or small. Eating and drinking is a massive thing. Patients with dementia often lose that ability, that independence when they're in hospital, because it's a different environment, it's different, even the different tools that they are using can be a massive impact. And we are currently helping the mealtime audits as well, to kind of get insight into what we are doing around the wards and around the areas and how we can improve that. So yeah, there is lots and lots of ways, and I'm always happy to discuss that with anyone.
That's really helpful. Okay, so we'll put your contact details into the chat. So I can't see any questions. So you've got away really lightly, Georgina, and then so I guess what we'll do is we'll draw this all to a bit of a close. I think there's a massive point in all of that conversation that the dementia diagnosis, it's not a spot diagnosis, is it? It's something that needs to take place with some due consideration from that point of view. Okay, and then I'm going to just say thank you all to our contributors, to Elaine and Kaylee, discussing Insulin Safety Week and the importance of that and the bite-sized learning. That's all in the chat. And then for Georgina, and encouraging you to just watch that video, I really would. So, and then finally from me, just a couple of things just to remind you all about the extension to the Excellence Awards, and just encourage to take that 5 minutes to submit a nomination for so we can really truly recognize people and say thank you. It's so important. And then finally, it's pretty hot out there, so remember to look after yourselves, hydrate. The one that we always forget, and if I look out the window here, I'm sure I'll see all the windows open in the towers. The towers work by air cooling, so if we keep the windows shut, it works better. If we open the windows, it doesn't work. It's that sort of paradoxical thing that we always get wrong. So that's my final update. I'll just say thank you once again to everyone who's contributed, and I hope you all have a good rest of your day. Thanks, everyone.